Hi, my name is Rex Pinter, and today I'm going to be going over what is telehealth and the key concepts it takes to run a successful telehealth business. All right, so first, what is telehealth? Telehealth allows for for healthcare at the comfort of your home, and that would include video calls, phone calls, and text messaging. From there, providers can prescribe medications online. This eliminates the frustration of going to the doctor's office and waiting to be seen, and also reduces the risk of infection because you are not coming into contact with another person. On the right here, I just have 7 benefits of telehealth: comfort and privacy, increased access to care, convenience, scheduling flexibility, easier to attend, improved engagement, and cost effective as well. Next, healthcare from a provider perspective. Well-trained providers lead to a happier patient perspective. Providers should try and create an in-person like event with their patients. Being familiar with the technology leads to more efficient work. Following company and federal policies ensure that everything runs smoothly and no one's rights are being violated. Having great telehealth etiquette is essential, and your overall goal, the provider perspective, is to make the patient perspective more positive. And so, what great telehealth etiquette looks like would be making sure that when you're on a call with a patient, that you have your camera at eye level and that you're making eye contact with it. And then also your background, it should be very calm so that your patient can be focused more on you. All right. Next is healthcare from the patient's perspective, what to expect. First, you should expect it to be a phone app or a website. For example, recently I've used Health and I have no complaints with it. It's very easy to use and to understand as well. You should also expect secure video chatting programs. So when a provider asks you to get on a call with them, it won't be on a Teams meeting or a Zoom call. It will be on a more secure site to ensure that your HIPAA rights are not being violated. And the next is convenient and accessible. Patients can access healthcare from their home, reducing the need for travel and wait times. This is ideal for those with mobility issues, chronic conditions, or living in rural areas. The quality of care, you should expect the same level of care as in-person visits. Effective communication, accurate diagnoses, and clear treatment plans are crucial. Next is the cost. Um, Telehealth can lower costs associated with transportation, childcare, and taking time off of work. And some virtual visits may also be more affordable than in-person appointments. And then on the right here, I just have a wheel of patient-centered care and what to expect. So that'd be video visits, text messaging, portals, in-person visits, and e-consultations. All right, next is technology. The technology you invest in will determine how well your company performs. So how will you contact your patients? Are you going to be using a website or a phone app to run your business on? And compatibility, you want to make sure that your system supports all types of devices from smartphones, tablets, to desktops. You also want a secure, stable, and user-friendly system. This not only will increase efficiency because it will be easier for your providers to understand and go about using the system, but it will also give peace of mind to your patients as well because none of their rights will be violated there. Um, Providers should have access to high-speed internet. This will make their life much easier. And then AI. AI is coming out with tech. AI has been rolling out with recently, and it's being introduced into telehealth. So, for instance, Teladoc Health, I had a question about my prescription afterwards when my doctor gave it to me, and I wasn't talk, and I go, you have to message them, and you're not chatting with a real person. It's an AI, and the AI will ask you questions to kind of direct you to the right people to talk to. All right. Next is policy. First, you want to have great company policies. This just ensures that you have a basis of what to expect and how to run your company. Federal telehealth policies. The first one's going to be HIPAA, Health Insurance Portability and Accountability Act. This ensures that patient data, privacy, and security in telehealth. State licensure laws. These vary by state. Some require separate license for out-of-state telehealth providers. And then the HHS and CMS regulations. So that has to do with establishing reimbursement rules and coverage policies for Medicaid and Medicare. And then lastly is the Ryan Height Act. You must have one in-person visit before prescription of controlled substances. All right, next is policy during a public health emergency. COVID-19 was our most recent one, and it brought about many changes to how telehealth. It mostly made federal policies more relaxed. So it decreased the strictness of HIPAA regulations, allowed patients to be seen from doctors, nurses, and from different states. So that relaxed the state licensure laws, and then expanded Medicaid to cover telehealth. That was the HHS and CMS regulations. And then on the right here, I just have more of how telehealth changed when COVID-19 hit in the public health emergency. All right, next is the business perspective. First, you need to have funding for this telehealth business you're going to start, and that can come from federal grants or nonprofit grants. It could also be self-funded as well. Business model. You want to have a market analysis, so you want to take a step back, look at the area that you're in. Is there other telehealth companies that you'd be rivaling with? Do people need your area of expertise? Are you in a rural area? Things like that. Um, Technology infrastructure. You want to make sure that the technology that you're using is stable and able to reach off to many devices. And then staffing requirements. You want to make sure that your staff are trained so that you ensure no one's rights are being violated and that your company is running as efficiently as possible. Then on the right here is a SWOT analysis actually of Teladoc Health, and you should be doing this to your own company as well. So you want to identify your strengths, your weaknesses, your opportunity, and your threats. And the threats will go into more detail here. Um, so abuse and fraud. This can look like stolen identity and false charges. So it's called uh, upcoding or unbundling. Refers to charging for more expensive services than those actually provided. And then unbounding involves submitting separate claims for services that should be billed together. And then identity theft, telehealth services require the collection of storage of sensitive personal and health information. Hackers might steal this data for fraudulent purposes, including committing insurance fraud or identity theft there as well. And then next is the future and innovation of telehealth. The first and the biggest one is AI. It's being introduced everywhere. Just like I said earlier, Teladoc Health has already implemented it, but also that comes into play with the wearable medical devices. So some people can wear things on their body that tracks their heart rate or respiration rate, and when it drops to a low level, will alert EMS in their area. And then next is major companies are buying telehealth businesses. So businesses like Walgreens, Walmart, and the biggest one here being Amazon, they're all looking to telehealth and finding major profit from it. And the one I want to focus on here is Amazon's One Medical. So on the right here, I have a picture from Amazon's website, and it kind of shows you just how simple it is. So you just schedule a meeting, and then they give you your provider, and then just like that, they have the prescription ready, or they tell you what the prescription is. And the big thing with Amazon is that they can now send these prescriptions to your door at a relatively fast rate, which is incredible, really. And then how do all these connect? Why is it important that you need to have all of them and not just one? Each telehealth perspective is needed to run a successful telehealth business. So if you aren't proficient in one, then the rest will crumble as well. For example, here, healthcare providers must be trained on their technology to provide a good service. Technology must be strong enough to avoid abuse and identity fraud, which, if not stopped, would damage profits in the business aspect. And then, in order for your business to stay operable, you must be compliant with federal policies. They all come together. If you aren't following policies, all of it crumbles. If your healthcare perspectives, if your patients are hating it and you have no providers that are efficient enough, the rest won't matter. If you don't have a strong business plan, people aren't really going to look. It's not going to last very long there as well. No profit's going to be made, and then policy. If federal policies are not being followed, you will just be shut down. But yeah, that is my presentation on teledoc and what it takes to run a successful teledoc business. And these are my preferences here. Thank you.